Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
An article on what to do after your loved one or somebody dies, and I don't know how prepared any of you are for take care. I know John has just lost his father and the son, so he's had an experience with that recently. And so many people talk about wills and other things like that, but not too many people talk about the logistics of what to do after somebody dies who's close to you. An interesting article in the post on three websites that you could go to address the logistics. John, did you have any difficulty in that, or any thought that you have of recommendations for those of us who will have to face that sooner or later?
No, my father had remarried, so his stepchildren had his arrangements, pretty much made. With my son, that was a shocker. There was really no preparation with him, but with the app group that we had, we started talking about the advanced directive. So I've made sure that I have mine, and I have to update it, and that really helps. But you're talking about after all of that,
Yeah,
So,
well, of course, the logistics that go along with that in terms of who to notify and those kinds of things. And apparently, they have three apps that are available: the Cake, Lantern, and Empathy. And I don't know how easy it is to know what to do when you have somebody who dies close to you that unexpectedly. They talked about this a lady whose father knew he was dying, he had cancer, so her father told her everything that he wanted her to do, from calling the mortuary to all steps that were involved. And what she concluded was, after the greatest thing that happened to her was that her father shared with her exactly what he wanted done,
mhm.
but also that there were apps out there that were helpful in terms of letting you know who you have to call, what to do with the Social Security, what to do with the insurance, what to do with this and that. And those are kind of aspects that we probably never discuss. We talk about advanced directives and those kind of things, even talk about wills sometimes, but actually talking about the details of what to do when somebody close to you dies sometimes is left alone. And so I just thought I'd bring to your attention that there are three apps out there that can help you in terms of preparing for something like that. Which
And Dr. Callender, I can speak to that. My husband died at the height of the pandemic, so much so until I didn't know there was a pandemic going on. And then once he passed, as far as making arrangements, everything was shut down. No one wanted to talk to you. No one wanted to come near you. You couldn't go into a funeral home. You couldn't go into a cemetery. Um, we made arrangements in advance, and it's a good thing we did. And I remembered when we needed to go to the cemetery, they didn't want us to come in there. Oh no, it's shut down. You can't do this. You can't do that. Good thing for us is we did it in advance. And so she eventually allowed me to come into the gate. She came down to the car to show me, paid in full. And that was the best thing in the world because I didn't have to go in. The arrangements were done. Even at the actual funeral, they didn't want family to come in to the cemetery. which I had to beg her, and I told her I'd get up in the hearse, and eventually she gave in and said one car. But luckily for us, the funeral home piece in the cemetery was done. And of course, at a death, you're confused, you're not thinking clearly, but to get that out of the way early, it makes a big difference. Big difference. So I would advise anybody to do that, and advance directive as well, so that you can have some guidance of how to move forward. It doesn't make it any easier on the back end, after everything is done, but at least you don't have to worry about that.
Yeah, I haven't looked at these apps that they talk about, but I'm going to see if I can look at them and give you some feedback. Any other comments about this that's going to happen to us sooner or later? So,
Yeah, one thing that's kind of interesting, if you have a relative that dies and they're not your spouse, you're not responsible for their debts. So like if a parent, child dies, the creditors will try to pursue other relatives, but you can tell them, forget about it. No money's coming from here.
any,
And what
And
Darryl
that
is
is,
saying is true because when our father passed, they were saying that I owed it and I didn't know anything about it and I was getting ready to pay it, and Darryl stopped me. He said, "Why? It's going to ruin his credit rating," and
Yeah.
etc. So I didn't think about it logically,
no.
but unless you're the spouse, it really doesn't even matter, sibling, but you seem that obligation, your parent dies and you want to make everything right. Also, if your advance director, unless you really got somebody you trust, it's not going to make any difference what you put down there unless you got an attorney to do that will. You have to have somebody in your family that trusts and will respect your wishes, because we had one relative, her mother didn't want to be cremated, but she cremated him anyway because of cost and money and etc. And she had it in her will not to, but relatives they do what they want to do once you pass. And then another thing is you're grieving, so unless you got the right funeral home and mortician that respects you, they're going to spend your money up and they're grinning at you and say you're the best person in the world.
Right.
They will sell you the most expensive casket, and so that no insects will get in it and all of that kind of stuff. And you sealing it, double sealing it, and double bagging it. They will take you for the loop and send birds in the air and everything because you're grieving and you want to send your loved one, but you're actually bearing your money. So you have to be very careful, and they do take advantage of you when you're grieving.
And you can save about 50% on buying online caskets as opposed to the ones they sell at the funeral home.
Yeah, that's an interesting point that Carol made about paying those bills, because people who are dead don't have a credit rating, I don't think. But the other thing is, I have had a few experiences with burying another person, like my son Sean Wilkinson, buried him. I, helped bury my cousin. And so when it came to my father, I knew all of the steps to take. So I'm not saying that it's fortunate that those people died so I could learn. I'm just saying you learn from experience.
yeah,
And those who have had no experiences, this is a time for you to think about it, and also think about the logistics, because you don't take for granted about the social security number, all those things that need to be looked after.
good morning. This is Betty.
Hi.
I too have had experience with death, as the Tatums know, I'm sure. But I heard what Darryl said and what John just said about debt after someone dies, but I'm helping really at this actual moment one of my girlfriend's husband died. His funeral will be this coming Tuesday. But she is now, and we live in Maryland, so I don't know whether different states have different regulations, but this is her husband, and she's saying that they are requiring her to pay his debts
Oh my goodness.
Yeah.
because he owns a home, two homes actually, and so if he has an estate, and that's what she's saying. I went with the same thing you all said. I said, well, when my daughter passed, I didn't pay any of her bills, but
Well, it's different between husband and wife.
yeah, so that's exactly what I'm saying. So, but this is her husband, and that's what they're telling her.
Yeah, yeah.
Now, if anything else happens later on, I will change this because I'll be following her. We're good friends since high school, so I
Yeah,
will
well,
keep up with it.
husband and wife are the two become one.
Yeah. So she's asked to pay his bills.
Yeah.
And the other thing I will say is, and it because I too have buried father, mother, so forth. I've had a great relationship with a funeral home. So I knew that they weren't taking me for a loop and taking me, like Carol said. I had established a great relationship with a young lady who had her own funeral home. And so that's one thing that was comforting to me, so much so even that rather than going to the funeral home, she came to the house to make the arrangements. So all of those things are comforting and helpful when the time comes.
Yeah, it may be helpful under some situations for the married couple to get divorced before the death.
Well,
Think about that, Darryl.
oh my. Okay. Well, well. Anyway, it's a topic that we all have to deal with. So,
Yes,
and any of you who want to look up the apps, they're Cake, Lantern, and Empathy, which is they address the logistics of what steps to be taken if you lose a loved one. Okay, John, how are you? Tell us about how you're doing. Give us an update. I mean,
Yeah, everything is going well. I have physical therapy and, every day, occupational therapy every day. The food is, I would say halfway good, halfway bad. It looks bad, but tastes a little bit better than it looks, that kind of thing. But, um, they're giving me my medicine on time. I talk with them about making sure the right medicine that they're giving me and talk to the doctor about that. And other than that, um, they have, Carol was telling earlier that they have a practice car in the activity room where you can practice getting in and out of a car. But I think I could still do that, but I just can't get to the car. So that's what I'm working on now.
the pain less.
The pain is less. I haven't needed any pain medicine since I'm here, but today I'm going to take some because the physical therapy seems like it's getting harder and harder. I mean, not harder, but more painful, physical therapy.
Yeah. Well, thanks for the update. We'll keep you in prayers on
Dr.
that.
Callender, I have one question for when he was discharged at Georgetown. Who's responsible for making up that medication list? The doctor or the hospital?
On the both, but the hospital is held accountable, but the doctor is supposed to do the medication list, and that's a joint responsibility. But it's the physicians is expected to do it.
Well, I know I just have a couple of problems and I just didn't know who to address it to, the caseworker or go back to the doctor that did the surgery or stuff, because the medication like the oxycodone was prescribed too much. They gave 2 tablets, no stool softener, and then some other things that they made errors on when they discharged him the first time. And then the second time, I can't get a hold of the papers, and I'm going back to the facility because they gave all the papers to the rehab center to look over it. I know John has checked into it, but they made a couple of mistakes on the medication that they prescribed to him when he first got out, and I just didn't know who to address that problem to.
It should be addressed to the physician, and the doctor usually writes the prescriptions, and the hospital takes joint responsibility. Because I remember I had a case like that, and I think they sued the hospital and the physician in that case.
Oh, so if they think I'm going to sue them, they won't talk to me, right? So I got to keep smiling.
No, it doesn't matter. That doesn't matter. What matters is that you get the right medication, and that's paramount. So, and the doctor usually writes those prescriptions, but suits come and go, so that's not the issue. The issue is to make sure he has the right medication, and that's the physician's responsibility. But I was just pointing out the hospital is equally responsible.
Okay, because I've tried to get in contact with this physician and I'm having the hardest time because I keep getting a circle of, I'm trying to figure out if he's really real. But I'm going to pursue it, try to get in contact with the surgeon, because and he was referred by another doctor. So, but anyway, thank you. So now I know who to pursue.
Yeah.
John, thank you so much for your update. Now, truly hope and pray that things continue to improve and get better for you, and you're back to your baseline. But Carol, I know how close you and John are. How are you doing?
Oh, I'm fine. I worked real hard. Those couple of days that he was home and wasn't supposed to be home and supposed to be in the rehab, those were sort of tough. But now everything, and he's closer to home. I don't have to travel across the world to get to Georgetown, and I'm saving gas, and he's close, and those nurses have to do all that work. I'm fine.
Good.
Okay. All right. Okay, John Buchanan, we can get the show on the road. Then we had a chance to share some of those items about preparing for the journey we all taken. This is a topic we've talked about before. We talked about the green bananas and the yellow bananas and the yellow, real dark bananas. And it's a fruit that is interesting that they say the humble banana. But it's a fruit that is enjoyed by many. It's a fruit that is very popular, but it also has elements in it that are great for the management of high blood pressure, and also because they contain a lot of potassium, they also, for the renal patient, they are taboo. Well, this is how they look as you see. We think of them as a yellow fruit, but as we know, and as Darryl had talked about, that the greener they are, the healthier they are, maybe. That doesn't mean they're going to be sweeter, because the more they go from green to yellow to darker, the sweeter they are, and therefore also the more potassium they have. So, but this is interesting. Of course, they don't talk about plantains, but It is, as you said, powerful fruit, and it's interesting. You see the small size as well as the large size banana.
Mhm.
Any of you not like bananas?
I don't like them. I love the smell. I've never been able to eat them. They make my throat itch. I don't know
Really?
why. Um, I'm gonna give this article. I was reading it last night. I'm gonna give it to my two sisters. They love bananas and always talking bananas. I have bananas. You want bananas? Not me. But it's something about a banana that makes my throat itch, scratchy. But I'm gonna give them that article. They would love it.
Uh,
Hello, Dr.
okay.
Callender.
Yes.
Yeah, a friend of mine, a nutritionist, was telling me 2 days ago that they found some nutritional value on the peelings from plantain. You see, when you remove the plantain, the covering, it says that the covering is very nutritional. I wonder if our health expert, Miss Elizabeth, can comment on that.
I heard the same thing about banana peels. They're talking about grinding the peels up into a flour, and it's very high in fiber, right, Darryl?
Yes, yes.
Yes.
Oh, okay. Yeah, banana peels are great. They're great for when you want to make a compost in your garden. They have benefits on what they call blooms. YouTube that tell you about the skin and other things. So the inside and the outside has great benefits.
What about the plantain?
Same. It's like banana.
I know.
It's
So,
same nutritional value. Some think it's even more nutritional than bananas.
okay.
It's of the same family, isn't it?
Yeah,
Yes.
it's just not as, it's a different sweetness. Yeah.
Yes.
And look at all the hidden values of bananas, of course. Of course, you have to like them to, but they contain.
Last time we talked about bananas, we talked about the inside of the banana peel. Those strings that come off, they have a lot of nutritional value.
Right. Mhm.
One of the points that just made that we scrolled past it is how athletes use bananas. When I run marathons at about mile 20, you get bananas, and you get them. Let's see, the water stops are like every every mile and a half apart, and every mile and a half from mile 20, you can get water, Gatorade, and bananas.
I
The benefit on the keeping the GI tract intact is also a little talked about, but when you talk about the fiber, that's what helps you go all the time.
I got a mixed message. I had dealt with constipation, like Janice talked about. You know, it seemed like almost right after she talked about it, I developed some constipation. I talked to the nurse at Kaiser, and I asked her about the fruit, and I mentioned I eat bananas. She said, no, bananas cause constipation. So I'm seeing a different message with this article here.
Right. I'd never heard that they cause constipation.
No, me neither.
But interesting from head to toe, the banana is such a good fruit. As I say, the only group of patients that is not advised to have bananas is the renal patient because of its potassium containing. I didn't know there were 1,000 varieties of bananas, but
Okay.
any comments about the banana, which is a great fruit for most people? It's an interesting article on this, what they call superfoods, and of course, most of these are going to be plants because it's clear that that's where healthy nutrition remains. And if we eliminated meat from the diet and replaced it with plants, we would be much healthier. I don't know the name of some of these food, fonio. Doug, I tell you familiar with that? Fonio?
Say it again.
Fonio, a grain native to West Africa.
Oh, Ponyo Island, Ireland.
Breakfast porridge on this grain. I never heard of it before.
Yeah. Yes, I've heard about that. I've heard about that place before.
Okay, I hadn't heard of Barama beans either, which is another of the superfoods.
Yeah. Yeah. I've heard about that island before.
Southern Africa, though. I don't know.
Yes.
Sierra Leone coffee.
Okay.
It's interesting how that coffee is thought to be, out of all the coffees, to be the one that's, and there are a couple of articles talking about how healthy coffee is for cardiovascular health, which is new to me. But these cactus pads is interesting. False banana, that's interesting. I never heard of that either. Oh, Ethiopia's ancient plant. Oh. Wow. Anybody have any Ethiopian background? I know. And then, of course, other beans, which are. Anybody like kidney beans?
Yes.
Yes. Yes. Yes.
I can take it or leave it.
I have a question here. We have such a high variety of beans, a whole different types of beans. Do they all have about the same nutritional value?
Darryl, you got any comment on that?
Yeah, wide range of nutritional value with beans. They're not all the same. And different digestive impact of different type of beans too. Some beans are very mild on the digestive system, like say for instance, chickpea peas or mung beans. Kidneys are a little more disruptive. By that I mean they produce more gas.
Okay.
So there's a wide range of effects and nutritional value for different types of beans.
Okay.
Well, my grandmother always said that the kidney bean looked like your kidneys. And the purpose of it is to go through the system and help clean out the kidneys.
Well,
That's an old wise saying.
yes, it is. Yeah.
That's it.
Go back to the seaweed. My beautician was telling me about there's this package. It looks like almost potato chips or something, or it comes in a little square package. And she said, I forgot what store it sells it, but it's seaweed and it's dried, and she serves it as a snack to her children. Anybody here eats seaweed, or it comes dried like that?
Yes. A doctor recommended one time that my thyroid had dropped a certain percentage, and my internal medicine told us he says, she'll work with you. Just tell her what to do. She'll work with you. And so he sent me to the specialist, and she said that since it's only dropped, since you keep a low sodium diet, and it only had dropped a certain small percentage, I'm going to suggest you eat seaweed and come back to me in 3 weeks. And so that's what I did. And it brought it back up to the level that my thyroid should be.
I think it has iodine, natural
Yes,
source of iodine.
yeah. That's right. And it comes, if you want to get it so that they don't charge you too much for it, go to the international store. And I think the other name for the international store when you go online is called Jumbo Foods. But go to the international store, because all the others, they're going to charge you for a big bag like less than $5. And that same bag, if you go to Costco, they're going to charge you $10 to $15.
Okay.
Now, the thing about seaweed is that on a regular basis, in some of the Asian countries, they eat that regularly. Like, for instance, Korea. I went to Korea, and that was part of their everyday meal, seaweed.
You also wrap sushi in seaweed.
Now here is an important point. It says seaweed can be added to salad, soups, wraps, or smoothie, or used as a wrap for sushi. Okay, we all know that one. But to potential benefits, high in iodine, like John said, antioxidant, protein, fiber, calcium, iron, and magnesium. It may reduce your risk of thyroid problems, cancer, arthritis, celiac disease, asthma, and breast cancer.
Mhm. 9 symptoms you should never ignore. This is interesting because many of us will have some symptoms and hope that they'll get better. But these are symptoms that really mean you need to do something right away. Sudden intense headache, unlike anything you've had before, can mean a number of things, but it really means you need to go see your doctor right away, because it could mean the end of your life. There are other things, of course, that aren't as severe as a ruptured aneurysm, but there's cardiac cephalagia, which is rare, meningitis, which is often fatal, then temporal arteritis, which causes a lot of pain, but doesn't kill you. Shingles in the forehead can cause pain as well. But the bottom line is, when you have severe headache, that's something you need to go to get to the emergency room and get taken care of to make sure it's not something that is lethal.
Dr. Callender, how would they eliminate these 3 symptoms right here?
Oh, they can do a CAT scan, and they can also do a lumbar puncture.
What is that? What's a lumbar puncture?
They put a needle in your spine and take out fluid, and that makes the diagnosis of meningitis, for example. But if you have a headache, usually the CAT scan would eliminate whether or not you have a brain problem. That would be done first, because if you have a brain problem, then you wouldn't want to do a spinal tap. But if your CAT scan is normal and there's no problem there, then the next thing they might want to do, if they think you have meningitis, is a spinal tap, which would make that diagnosis. Temporal arteritis is different because that would all the other tests would be negative. And for shingles, which the herpes zoster, they'd have lesions that would help you with that. Then, of course, it could be a brain tumor as well. So the headache, that's number one. Number two, chest pain. And that's a heart attack until proven otherwise, even though we talk about GERDs and indigestion and all those other things. It's a heart attack until proven otherwise. Whether it's heaviness or pressure goes down your arm or not, first thing you want to be sure that it's not is that it is a heart attack. Then they have other tests. And of course, the GERDs, which is a commonly cause of chest pain, can be diagnosed by x-rays as well. But the key thing is the heart attack until proven otherwise. That's the best way to look at it. Number three is unexplained weight loss, which brings the issue of fragility and frailty. When you lose weight in an unexplained fashion, you're not trying to lose it. And then that's a serious symptom that requires you to see the doctor, find out whether it's diabetes or something else.
Mm.
The biggest fear, of course, is that it means cancer, but diabetes and other conditions are equally associated with unexplained weight loss. And then number four is any bleeding of any kind, whether it's from any orifice, is something that you need to worry about. Although if you're over 40, you should already have a colonoscopy. The problem actually we're seeing is that having so many people who are under 40 who have colon cancer, which is then I think the incidence of people under 40 who've had colon cancer is increasing, and so 40 is the age unless you have colon cancer in the family, in which case you could have a colonoscopy earlier.
I had a question, Dr. Callender, about nosebleeds. They didn't mention that. What can cause a nosebleed?
Well, so many things cause nosebleed that usually the causes for nosebleed are not problematic. I mean, usually you put substance in the nose, stop the bleeding, and it doesn't. Usually, the one thing that you have to be concerned about is that you don't have high blood pressure. But if you don't have high blood pressure, then packing it is usually sufficient. And they don't talk about that because it's not as associated with other serious conditions. But blood anywhere else is a concern because it means you've got an underlying problem which needs to be diagnosed and treated.
Dr. Callender, this is Sylvia. Have you heard of an altered immune disorder? I have a friend who has that problem, and his skin reminds you of Job in the Bible when he had boils and blisters all over his skin, and they don't have a cure for it. I hadn't heard anything where there's no cure at all, but the blisters come just at will. And of course, they're like pus-like blisters, and they burst, and then more come later on. And they were like, the person was saying they don't know why this happens.
Yeah.
Any information on that?
No, that's a condition that
Welcome.
we don't know the cause of it. Yeah, and very often they treat it with steroids because they don't know any better way to do it. But yeah, I don't have any. Can't help you with that. That's a condition that remains elusive.
Yeah, I mean, when you're saying, conditions you should not ignore, then I was wondering, and since it attacked the immune system, what should we look for in terms of such a disease or disorder that will attack the immune system? What should we be looking for to be sure our immune system is? I mean, I know we take the shots and all, but
anytime you have infection anywhere, whether it's the skin or anywhere else, that's one of the signs of immune deficiency. And the skin, of course, is the largest organ in the body and will often manifest because the skin fight is the first sign.
Yeah, well, I did.
First enemy.
I checked on it.
Yeah.
They said that everybody said they're all right. It's just when, because what, like one of my girlfriends and
wait a minute, I can't hear. Rochelle, you
I'm
need to
sorry,
repeat?
I'm sorry.
Yeah. So the skin is the biggest protector, and so the skin is the source that things attack from outside. And whenever you have any skin reaction, dermatitis, any dermatitis, any skin infection, that's something that you need to follow up with your dermatologist to make sure that it's not unmasking immune deficiency. But usually the immune deficiency may manifest itself by skin issues or any high persistent fever.
I see. Okay, thank you.
Because your immune system fights infection. And if your immune system is not up to par, then you're likely to get infections of the skin or anything.
So in this particular disorder, I guess the immune system is not working, or?
Yeah, well, there's so many ways the immune system protects us. And when it's not working, then you're subject to have all kinds of illnesses, especially those which manifest themselves by causing infection. Because infection, whether it's the lung, the skin, the heart, if the immune system doesn't do the job, then we try to get antibiotics to try to help us. You can have sinus infection and other things, but whenever you have a high fever, that's one of the concerns.
Dr. Callender.
Yes.
Hello. Yeah, please, can you give me some clarity on this question of colonoscopy? Are there any obvious signs, for one?
Are there
any obvious signals?
No.
No. For one, yeah, okay, hold on, let me finish. If because according to what you just said a few minutes ago, if there's any history of colon disease or something, then you have to go for colonoscopy before the age of 40.
Right.
Otherwise, you can go for colonoscopy after the age of 40. I see. So if somebody, I have a cousin of mine He's almost approaching 90 years old. He has never gone for colonoscopy. Is there any obvious signal that will make him go for colonoscopy?
Well, anemia, if the hemoglobin is low, that's one of the
Okay.
late signs of colon cancer.
Okay.
And at the age of 90, it's a judgment call as to whether he should get a colonoscopy or not. But if he has anemia, then that's a sign that he should do. And then, of course, if you have any diarrhea or constipation, those are indications. Then if you have any blood anywhere, that causes an indication.
Okay.
But
All right.
usually the earliest signs would be the constipation, diarrhea, or low blood count, low hemoglobin, anemia.
Okay.
But
Thank
if he
you.
doesn't have anemia and there's no history in his family, at the age of 90, they may or may not be reluctant to do a colonoscopy on it.
Okay.
If he has
Thank you.
no history, family, and if he has normal bowel movements, and then it's a judgment call. Remember the person who gave the talk indicated to us that above the age of 80, it's a doctor and patient decision.
Okay. Thank you.
Now, shortness of breath is something that is a sign that could be a pulmonary embolism, could be heart trouble, could be asthma, could be bronchitis, could be pneumonia, could be a number of things, chronic obstructive pulmonary disease. But shortness of breath needs to be checked out.
I have a question about
you know it. Yeah.
I have a question about the pulmonary embolisms. I suffer from those, and I looked at the causes that you've got there, and I don't come under any of those causes, but I do. I have gotten them over the last 2 years, very seriously 2 years ago, where both lungs had PE in them, and then just this past June, um, sudden tightness, shortness of breath, and I ran over to the hospital quick as I could. And they said, yeah, in my left lung, I had PE forming again. And so I'm on blood thinners, but I hadn't traveled. I'm a very active, physically person, and hadn't had any surgeries ever in my life. But I'm still getting these. And so I met with the doctor just last week. We're trying to figure out what some of the other causes might be other than what you've got, what's written down here.
What anticoagulant are you
on? Eliquis.
Oh, that's the best one. Okay.
Yeah.
Did you get them in spite of Eliquis?
No, as a matter of fact, they put me on Eliquis after I got the first one. And then I went for about 18 months, and the doctor says, well, you haven't had any flare-ups or anything like that. We'll take a look at you, going off them for a little bit. So I went off of them, and then they came back.
So you're going to stay on it now?
Till the day I die. And hopefully it won't be because it's a blood pulmonary embolism.
Yeah. Well, as you heard from Dr. You may have missed Ivy's presentation though.
I might have.
Yeah. Okay. He talked about the venous circulation and how that is the dominant cause of embolism, but your case may be completely different. But because most of the pulmonary emboli begin in the veins, get clots and they break off, but that may not be the situation in your case.
Yeah.
But the treatment, of course, is the Eliquis.
Dr. Callender, what's the difference in Eliquis and Coumadin?
Eliquis is the more modern version of Coumadin that is the more sophisticated anticoagulant that has fewer side effects. So Coumadin has is less easy to control than Eliquis. Eliquis is easier to control and doesn't have as many side effects. And that's why Coumadin is the oldest, one of the oldest anticoagulants there is. But it is not as efficient as Eliquis, and it has more side effects. In other words, you have to get certain blood tests with Coumadin to make sure that the level is accurate. Which
I have a friend who needs a kidney, and he's on the transplant list, and he's on Eliquis, and they're trying to wean him off Eliquis and get him on Coumadin so that he can have surgery. Does that sound?
Okay. Well, of course, if you're on Eliquis and you have to have surgery, then that's a problem.
Okay.
So then you put them on Coumadin, you're able to titrate the level because Coumadin, you can do blood tests to from time to time things to let you know the level of Coumadin, and then you take them off Coumadin, do the surgery, then put them back on Coumadin, and then after a while I'm on Eliquis. But for surgery, you need to stop. If you're going to have surgery, you have to stop the anticoagulant.
Right.
And the Coumadin is more reliable in terms of being able to identify how much, how to monitor your ability to stop bleeding. And so with Coumadin, they can do confinement times, other things that are able to allow you to monitor the coagulation level. Whereas with Eliquis, it's pretty much you're anticoagulated, and therefore you'd have to stop it completely. And then after you had the surgery, you may put them back on Coumadin and eventually get back to Eliquis. But yes, that is an issue if you're going to have surgery.
Right.
Yeah.
Okay. Thank you.
Sudden confusion. This, of course, may mean a stroke, and so or a brain tumor, and so anytime that happens to anybody, that's an indication to go right to the hospital. Slurred speech as well. Numbness, change in the face, all of this, and then of course what they don't say, but you should also have, if you can't see, if suddenly you go blind, that's also an indication of a stroke. And when treated quickly, it can be reversed. So any of these symptoms or being unable to see requires emergent hospitalization, because now we have medication that can dislodge the clots and eliminate them and have you have reversible brain situations. So all of those things, those are issues that really warrant you going immediately to the hospital. Swelling in the legs. I think somebody asked about that in the meeting. Can be caused by the heart not pumping the blood. It can be caused by the liver not doing a good job, and it can be caused by the kidneys not doing a good job. So accumulation of fluid called edema is a problem that requires urgent diagnosis, as was discussed by Dr. Ivy. The venous insufficiency can also do it, as he talked about the gastrocnemius muscles being the heart of the veins. And so if the veins and if the valves are not working right, if the gastrocnemius muscles are not pushing the blood back where it belongs, then swelling can result, and compression stockings can help. But the swelling is serious symptom of something going wrong, whether it's the heart, the liver, or the kidneys.
Dr. Callender, this is Elizabeth. Again, good morning. I see a lot of swelling at the ankles of ladies. Is that related to that as well?
Well, that yeah, as Ivy talked about, venous insufficiency due to varicose veins or other thrombophlebitis and those kinds of things are the cause of also a cause of edema, and the heels and that women wear and, don't help in that situation either. But if somebody has swelling in the ankles, the question is why. That can only be answered by finding out whether they have venous insufficiency, whether they have, whether it goes away when they go to bed, lie down. If it does, then maybe compression stockings may be the answer. That will be that simple. The easy answer is if when you go to bed, it completely disappears. That suggests that it might just be venous insufficiency. But it depends. If it's just a small amount, it's one thing. But if it's a large amount, then the heart, the liver, and the kidneys may be suspected if you don't have venous insufficiency. Those varicose veins can cause that. Abdominal pain is, of course, that can be anything. Aneurysm to perforated stomach or intestine. So, could be gallstones, it could be diverticulitis. There's so many issues, but sudden or severe abdominal pain requires you to go to the hospital and get a diagnosis made. Some of these conditions, if they're not taken care of early, will result in your death. So, abdominal pain is a sign to go to the hospital. And some people will say, well, I'm going to see if it gets better. It doesn't get better within 12 hours or so. You can go to the hospital, find out what is causing that pain. And there are many conditions that contribute to abdominal pain. Any other questions about those 9 symptoms that require you to do something about it immediately? Okay. And this is an article that was surprising to me, that coffee is associated with reduced cardiovascular disease. It's interesting, it also reduces atrial fibrillation. America is a country that kind of lives off of coffee. And so it's interesting to see that coffee has beneficial results, because I'm sure a lot of people will be happy. It's considered part of a healthy diet. It's hard to believe that, but that's what the data is now demonstrating. Any comments? Any of you coffee drinkers?
Yes.
Yeah, well, you take pleasure knowing that it's good for your heart. And they go talking about, and for a long time, it was thought that coffee was not that good for you. But now you can see that it's good for you.
Yeah, good.
The coronary arteries, decrease the likelihood of stroke. People are drinking the coffee. Now, we also have good data about tea, black tea as well. But so tea and coffee seems like okay.
There is one issue, doctor, with coffee. I just got my blood work done, and one of the suggestions was to cut back on coffee if I have stomach issues because it may be acidic.
Okay, all right. And this really is only talking about the cardiovascular benefits, but you're right.
Mm-hmm.
It could have other results.
Mm-hmm.
And we know that actually caffeine is related to some of the breast pain that some women have. So, but this is only talking about the heart protective aspects of coffee.
Mm.
Any other comments about good things associated with coffee?
Yeah, I was trying to hold back, but the conversation about acidic foods, which coffee is included, and other acidic foods are going to be meat of any kind, alcohol, and sugar. Those are the primary acidic foods. And it's said that the more acidic your body systems are, as far as their blood pH, the more prone you are for cancer, that it sets up an environment where cancer is successful, as opposed to eating alkaline foods. You're not creating an environment that makes cancer successful.
Okay, thanks, Darryl.
And, doctor, isn't there, and Darryl may know this, as far as the coffee, the preparation of the beans is what they use to prepare it adds a lot of acidity to it, so that you can get coffee that is prepared differently, the beans, and you don't get such acid in it.
Oh, is that Kevin?
Yes.
Give me a call later, please.
Okay.
All right. Okay.
I don't know about coffee preparation because I only drink water.
Yeah.
Okay.
Okay. This is interesting. This is one of the areas that we need to talk more about, is that the dental health. We talked about many other aspects of health, and I guess one of the concerns about dentistry is how expensive the implants are. Talk about less expensive implants. I didn't know they had them. Because when you go to the dentist and they talk about implants, they talk about at least 5-digit figures. But I think maybe an ounce of prevention is worth a pound of cure here, in terms of the importance of cleaning your teeth twice a day and flossing, those kind of things. Maybe.
Well, my daughter my younger daughter always tell this joke. She says she was going to this dentist, an older dentist, mature, that she just really loved before she moved out of the area. And she says he would always tell his patient, well, just take care of the ones you want to keep.
Yeah. Yeah. But it's a matter of discipline. It's a matter of discipline that you can get yourself to use the brush your teeth and use the floss. And this may keep the teeth that you want, which is all of them.
Well, one of the things.
Go ahead.
Go back a little. They were talking about the jaw one time. One of the things that my doctor said, my internal medicine doctor said, that when I go to the dentist, always have when the hygienist does my cleaning, always have the dentist to do an observation, because one of the side effects of hypertension medicine is that it affects the jawline. And so he has to always check to make sure there's no side effects of that. And the other thing, my husband went to a presentation regarding dental care, and they were talking about the implants, that if your doctor retire or go out of business, or your dentist retire or go out of business, other dentists won't work on implants or anything of that major that someone else has put in now.
Okay, I don't know the answer to that question.
Oh no, I'm sorry. That was just a comment. I'm sorry. That was
Yeah,
just a
but I'm
comment.
just saying I don't know about the fact that other dentists would not take care of you because somebody else did the work.
Yeah, I have the brochure around here somewhere, but yeah, he just went to one this week. It was just to inform the senior citizens of certain things that are going on now.
Okay. Well, I think it is a major breakthrough if they have less expensive implants, because finding implants that are less than 5 digits is unusual. And I think the point that your doctor raised about having the dentist evaluate you in addition to the hygienist is important, because not only about the jawbone, but also other issues that the hygienist might miss, that maybe early manifestations of infection or even cancers.
Right.
3D dentures, look at that, is even coming into the fray. We talk about road 3D printers, stem cell teeth. No limit, huh? May in the future, you may grow your own replacement teeth. Well, okay. What to do if you can't afford a dentist? That's oh, okay. Whenever you eat, the mouth becomes acidic. So wait a minute, about an hour before you brush. Ask your doctor for a discount. Check your Medicare, Medicaid benefits. Try dental school. That's good advice. They do it much cheaper. And then the public dental clinic, which wise parents do for their kids from the time they're little. Yeah. I think all of these get to the ounce of prevention is worth a pound of cure, and brushing and doing your teeth twice a day on the minimum is probably a way to avoid a lot of this. Because when you get over 60, you find that many people don't have their own teeth. They have these implants or other teeth. So the best advice is to not supplement. Well, we go into the flu season. And so many of you have gotten your there's interesting data that says that only 2% of the eligible people for the vaccine have taken it. But it is now is around the time as we approach October for you to get your flu shot, because at the end of November the flu season starts. Actually, November and December, and so now's the time to start getting your flu shots. And those of you who want to get the new vaccine with the COVID vaccine should take that as well. Now, in terms of differentiating, you can have a high fever with flu, you don't have that with the cold. You can have a fever from many other conditions. So high fever doesn't necessarily mean that you have the flu, but it means you got infection likely. But a cold usually doesn't give you a fever. Aches and pains is usually flu, and not usually cold. Although the vaccine will give you that myalgias, but chills again are likely mean that you have the flu, not a cold. Now we've learned about how to prevent these by masking, washing your hands, social distancing. The question is, will we continue it? Okay. Fatigue is also a sign of the flu. It's not as likely with colds. And many would suggest that fruits and vegetables and plenty of fluid and proper rest go a long way as well. Sneezing is more of a sign of a cold than anything. And this shows you how we should be doing. Old people get used to coughing into their hands, which is something that we do instinctively, but this is the way that we should be doing it. Running a stuffy nose alone is usually a cold. And any intense symptoms is likely the flu. And then, of course, the runny nose, real runny nose, annoying. And sore throat. What do you take? Yeah, it's a good question. Most people take decongestants, Motrin, any of those products like that. If you only have a cold, they might help. The flu requires specific treatment. And we do have effective treatment against the flu. This is a very interesting article. On the face of it, they say healthy people may not need bivalent boosters. May, that's the key word. And young, healthy are the key words. And while only 2% or 3% of eligible people who could take the vaccine have taken it, certainly those people who are older than 75 and have chronic diseases or immunocompromised should take it without question. Younger people are less likely to have problems, but still can have problems. And so it's just that the group that needs it, must take it, is the older group and the immunocompromised group. The younger people may be able to fight it off. But it's still recommended if you have not gotten the booster to get the booster. It's just that those younger people are less likely to have the BA.4, BA.5 variants. So this is an article that suggests that it may not be necessary in younger people. That's a controversial comment. I think what he's saying is that there's less a risk of getting it in the younger people than it is in the older people, who are likely to have more severe illness or even death if you don't get the vaccine.
Dr. Callender, I was wondering, I included another article, but I didn't get your approval on it. Did you see the one I was talking about with the rapper lady? This one?
Oh yes, yeah. I think that's wonderful. I think that the more we can do to emphasize the importance of mental health in all populations. Now it's interesting that the data doesn't show that the anxiety issue is as much a problem for those over 65, they say. Whereas for those under 65, it is clear that we've got a mental health crisis in anxiety. And so I think anything that can be done to encourage people to see the psychologist, the psychiatrist, whoever you need to see to get treatment for a mental health issue is absolutely imperative. We have a mental health crisis in the United States that is made worse by COVID. And so one of the issues is the stigma associated with mental health, and also the ability to find the therapist who will take you as a patient. Some psychologists won't accept Medicare or Blue Cross Blue Shield. They want to have a cash. And so I think the biggest problem is the stigma. And so what this rapper has done is a wonderful thing. And I think we need to have more people who do that, because we had a program on mental health, and one of the things that was brought up was the fact that faith is a wonderful thing, but Christians commit suicide just like anybody else. So just because you're a Christian or whatever religion you are doesn't mean that you can't have mental health problems, because the enzymatic problems in the brain and other issues in the brain occur to people of all religions and all ethnicities. And so encouraging people to get mental health treatment, whether you're a Christian or not, or religious or not, and as what she's doing, I think is wonderful. So I think that anything we do to encourage people who have mental health issues, whether they be anxiety or depression or whatever they are, I think the better. Any comments on that?
I included a link in the phase 1 articles for this week, an interview with Arthur Evans. He lives in DC right now. He was on C-SPAN the other day and did an excellent interview concerning mental health issues, anxiety and depression. And he even received, phone calls from all over the country with people with questions about that. So I highly suggest everybody, it takes about almost 45 minutes to an hour to listen to it, but it's very pertinent. He's brilliant, and he's a friend. I really would like to have him come and talk to us.
Why don't you? He's a friend. Well, why don't you encourage him? Yeah, let us know when he can come talk to us. We'd love to.
I'm going to do that, but everybody, please take some time out to listen to his interview. It's excellent.
Yeah, and I think the fact is that, early on this group, we talked about the fact that the mental health crisis is upon us, and that we are ill prepared to deal with it. And so the more we can do to address these mental health issues as early as possible, while it can be treated, the better. So I think thank you very much for emphasizing that, and I'll take a look at it myself. I haven't looked at it yet, but I will, because I think we can't overemphasize the importance of taking care of these issues while they're treatable. And we have suicide is taking too many people, young and old, and recognizing that whatever religion you are, your brain still has dysfunctions that can be treated. Any comments on this, which some may think is antithetical, but it's not. It's just facing reality that Christians commit suicide, religious people commit suicide, and those who aren't commit suicide. It may be that those who don't have faith commit suicide more often, but it's a reality that we have to face. Any comments on this?
Well, I think that mental illness has been around a long time. I think now it has become an outcry, because when I reflect back over the years that I've been on this earth, and I've seen it in kids, very young kids, and
Well,
that was a class of 20.
When
That
you
was a
think of
class of
people growing
25.
up you think of people growing up in DC and Chicago, those kids who see so much trauma, they've got to grow up with mental health issues.
Right. And those kids that are in those southern states that saw their relatives lynched and different things happen to them. And there was a saying that and in some of the southern states, it was to the point that they kept a hobo. They used to call them hobos, and they would keep a bag ready just in case a Black young man, a Black male period, would have to flee. And my grandmother would, on weekends, she would do nothing but fish fry. And I remember as a little girl that, because I would always help her out. And I remember as a little girl, hobos would come through and she would say, we don't charge them anything. And that was her way of helping them. And so, it's been, I think it's just been around a long time. I just think it's been an outcry.
Any other comments? Okay, well, thank you very much for a great session, man.